Okay, so to start our posture assessment, we're going to start on the posterior, okay, and then we're actually going to work from the ground on up. So the first thing that we're actually going to take a look at is that Achilles tendon on each side and kind of see how that's lining up. And from what I can see, especially on the left side, just tilt in just a little bit. And then moving up from that, we're actually going to go towards our calf and see how that is bulked to see if they're even or not. And then also if that bottom of the heel is aligning with the knee, then you can stop because that messes it up. So and then from that, we're actually going to move up to check the thigh to make sure that we're even on both sides with that. And then same thing, just kind of making sure the butt crease is even. And then moving up from that, we're actually going to go up towards the hip, towards the PSIS, to make sure that that's kind of level, which we're looking pretty good there. And then from there, we're actually going to go to the hand position, just making sure that there's not too much inward or outward rotation of the hands. So we're looking pretty good there. And then from that, we can actually go to the elbows and making sure that there's not too much inward or outward rotation with that as well. Okay. And then we can kind of see if there's more or less crease in between the arms to kind of see if there's any shifting from one side to the other. So there's just a little bit more on that left side rather than the right. And then just checking that rotation of the scapula to see if one is higher or lower than the other. And then also to kind of see whether or not the shoulder is inward or posteriorly rotated. And then moving up to the shoulders, kind of see how the shoulder height is, whether or not they're too much flexed or not enough flexed. And then moving up to the head, seeing if there's any tilt from the ears, as well as in the neck. Okay, so I'm back again. Just this time we're looking at the lateral side of that posterior assessment. Okay, so and then same thing as the last one, we're actually going to start from the bottom and work our way up. So looking at the feet again, we're just going to check at the ankle and then just checking at the feet to make sure that there's not too much inward or outward rotation. And then we're going to move up towards that knee, just kind of seeing if there's too much flexion or extension there. And then just checking the muscle bulk again with the calf and the thigh. And then moving up to the pelvis to check if there's any anterior or posterior rotation. And then again, just checking that lumbar spine, making sure that everything is kind of in alignment. And then we'll kind of go up again to that shoulder positioning, kind of see if there's any anterior or posterior movement from the shoulder. So nothing too crazy there. And then looking at the head position again, making sure that ear is kind of in line with the shoulder and kind of seeing where that is at. That is about it. Okay, so we're back again, but this time we're actually going to be looking at the anterior view, or that front side. And as we have been going, okay, we'll start from the feet and work our way up towards the head. So again, taking a look at the feet, seeing if there's any inward or outward rotation of the feet. So we're just seeing a little bit more of the movement inwards, so kind of a flattening of the feet or a pronation going in. And then we're going to go up towards the ankles and towards the tibia. Just kind of seeing if there's any inward rotation at the ankle as well. And then checking the Q angle and that knee to see if there's any kind of inward or outward rotation of the knee, which is looking good there. And then checking just again for that muscle bulk, which is pretty even again on both sides. And then just moving up towards the pelvis and the abdomen, just kind of seeing if there's any rotation forward or back. And then checking at the hands and the wrists, just kind of seeing if there's any inward rotation at all. And then kind of going up towards the chest and towards the shoulders, or even towards the clavicles, just kind of seeing if everything is even there, which is looking pretty good. And then again towards the head positioning and the face, making sure the eyes, ears, and neck is kind of in line. So for this time around, we're going to be looking at the posterior view, but being seated this time. Okay, so we're actually going to start again from the bottom on up. So taking a look towards the thorax and that shoulder height, making sure that we're even throughout here. And then also checking again towards the head, making sure the ears are level, as well as the neck. And then we'll actually rotate to the lateral side to check and see just again the head and the neck, as well as the shoulders, as long as there's not any forward rotation or backwards rotation. And then we'll actually go to, that's it.